So what a hernia actually is a defect in the abdominal wall. Our abdomens are essentially an envelope of very strong material. One can think of it as biologic fiberglass or maybe plywood with different layers of muscle and fibrous tissues that create really an impenetrable envelope. But unfortunately, sometimes holes develop, usually at places that they were naturally. For instance, we were all attached to our moms through our belly buttons when we were developing. And particularly men, as it turns out, testicles actually start life up next to the kidneys, but they don't produce viable sperm in such a hot environment, so they have to be somewhere colder or outside the body. So they had to get through the abdominal wall somehow. So a hole developed to allow the testicles to pass through. And as the testicles pass through, they still have to be attached to something. There's a sperm tube and there are vessels and nerves. The body collapses down on those to seal the hole pretty well, but sometimes that sealing does not work perfectly. And that's how groin hernias develop. Belly button hernias develop at the umbilicus where we were attached to our mothers, and sometimes the sealing of the umbilical cord at birth is not quite perfect, and later in life a small defect develops, and whenever there's a hole and a pressure differential, for instance inside our bellies, whenever we cough or trip or sneeze or stub our toe, our pressure goes up dramatically. And what's inside tries to get out if there's a hole. And that's how a hernia develops. So when they're small, it's usually just a small piece of fat goes through the hole, and it's just annoying, sometimes painful, but not dangerous. When they get larger, a piece of intestine can actually go through. And that's potentially problematic if the intestine that's going through kinks off or twists. Its blood supply can get interrupted, and it can actually burst. It certainly would be fair to say that not each and every hernia needs to be treated. Now that being said, hernias really never fix themselves and they never get smaller. They can appear to stay the same size for a long time, and it certainly gives people the idea that they can tough it out for a while, and in fact, sometimes they can. But eventually it probably will get bigger, and a small, merely annoying hernia can become something that's dangerous. And like most things in surgery, when it's a small problem, it's easier to fix than when it's a big problem. So if people are fit for surgery, it's usually better to fix the hernias while they're small problems.